May is Stroke Awareness Month, and the numbers are quite sobering. Every 40 seconds, someone in the U.S. has a stroke, but recognizing the signs and acting fast can make all the difference. Joining us now to talk about what to watch for, what to do, and how Kaiser is speeding up life-saving treatment is Dr. Saad Yazdani, a neurointensivist at Kaiser Permanente, Sacramento. Good morning to you, doctor. Thanks for coming in.
Thank you so much for having me, Jay. I appreciate the opportunity to talk about stroke, an issue that affects hundreds of thousands of Americans every year.
Yeah, let's talk about this. We showed the statistics there every 40 seconds, so this is clearly a danger. Talk about what stroke is first.
Yes, let's define the problem. So stroke is a blockage of blood vessels to the brain or from rupture to the blood vessels in the brain. And that results in decreased blood supply and oxygen. And that's a problem. We know that for every 1 minute that the brain goes without blood supply, that 2 million neurons die. So stroke is a big problem.
Yeah. Signs to look out for?
Yeah, so there's a medical acronym that the American Heart and Stroke Associations endorse called BFAST. So briefly, that would be changes in balance, all of a sudden tripping or feeling dizzy, changes in your vision, so either blindness in one or both eyes or double vision. Then we look for signs of weakness, like the face is not the same on both sides, weakness on one side, weakness in the arm or leg, speech difficulty, so difficulty getting the words out, or speaking, and then T, the last thing is time, right? So time is brain, so identifying this and getting help early is key to preventing morbidity and mortality.
I can see with all of those symptoms there being, opportunity for confusion there. You might just think that you're a little lightheaded or something like that. What do you tell a patient who's like, I don't know if it's a stroke or not?
Right. That can be very difficult to understand, and I think that's where we step in as physicians and healthcare providers to try to tease out what exactly is going on. But I think the big message here, the take-home message is seek medical attention if something new pops up. Through Kaiser, we have the ability to be able to quickly intervene and screen patients to see, hey, am I really having stroke symptoms or not?
Talk about what we can expect from Kaiser's treatment in particular, because you guys have a really great program. Yeah,
let's segue into that. So Kaiser has a robust telestroke program where you can get access to professionals and neurologists within seconds of emergency room arrival. Really, the purpose there is to screen you to see, are you having a stroke? Number two is to make sure if you qualify for a clot-busting medication called TNK. And the last thing is to rapidly triage you to our comprehensive stroke centers in Sacramento and Redwood City to see if you qualify for a procedure called thrombectomy, where we fish out the clot.
As far as demographics go, is there any age group more vulnerable to a stroke?
Yeah, that's a great question. So we know that cerebrovascular health or brain health is intimately tied with heart health or cardiovascular health. And so as you get older, right, increase in diabetes, increase in cholesterol, blood pressure, sedentary lifestyle, diet changes, all these things accumulate over years. So I would say as you get older, we know that age is a stroke risk factor. And we know that these other risk factors, people with diabetes, high blood pressure, high cholesterol, also increase the risk of having stroke.
So as far as prevention goes, I'm guessing diet and exercise top of the list?
Yeah, there's no surprises here, right? So like I said, heart health and brain health are intimately tied together. So making sure you get mild to moderate exercise, 20 to 30 minutes a day, important. Diet, Mediterranean diet, important. Make sure that we're not smoking or vaping, making sure we get our annual checkups, and then controlling our risk factors like high blood pressure, cholesterol, those types of things.
Important to highlight. Dr. Saad Yazdani from Kaiser Permanente, thanks for coming in.
Wonderful. Thank you, Jay.